I've been using Aquamanus for about 5 years, and have found it's very beneficial to my patients in that it is associated with decreased blood loss during surgery and after surgery. I think it can enable any approach, anything from fracture care to hip replacement or knee replacement, anytime where you're doing a procedure where there's potential for blood loss. It's a very gentle way to control your blood loss during surgery, but also has the benefit of diminishing your blood loss after surgery. So that's a wonderful thing about the Aquamanus. And on top of that, it's very easy to use. Doesn't require a lot of training to use it. And I must say that initially I was skeptical about the device until I started using it. And once I began using it, then I really saw the light. Early on, I saw the light during surgery, and then post-operatively, you could see almost zero blood transfusions, minimal hemarthroses post-operatively or hematomas, depending on what you're operating on. But it really has been a huge benefit, not only to my practice and my patients, but also has allowed me to go into more avant-garde approaches like tourniquetless knee replacement or anterior hips, stay cutting edge. It allows you to do more. Well, it's interesting. We would go tourniquetless on patients who had prior vascular disease and had a bypass, a graft of some kind, Gore-Tex graft. And when we consulted with the vascular surgeons, they would recommend not using a tourniquet for the knee replacement. And I noticed on those cases that they were no more difficult to do than a surgery where we did use a tourniquet. And then I actually went to a Medtronic-sponsored course at the Hip and Knee Society, I'd say four or 5 years ago. And there were very well thought out discussions from several physicians around the country doing tourniquetless. And it just resonated with me. I felt that this was really a great way to go. And when I came back, I didn't even put a tourniquet on a knee, because I was fairly confident that I could accomplish a good result without a tourniquet. And so in those cases, I went basically cold turkey without a tourniquet and have never looked back. The benefits of going without a tourniquet really are you remove a negative factor on the surgery. So think about when you do a knee replacement, you're doing a fairly traumatic intervention on somebody's knee. And to add to that ischemia and muscle pain from the tourniquet and possible nerve injury, there are a lot of reasons, there are things you can avoid by not using a tourniquet. I think the benefits are pretty clear. I think there's less patient complaints of pain post-operatively, less bleeding, which is counterintuitive, but there have been recent studies showing that. And the reason for that is that where the bleeders are, they're very predictable. The problem is you cannot see the bleeders when the implants are in place. And so going without the tourniquet allows you to stop the bleeding as it occurs. Therefore, you have less blood loss during surgery, but also you eliminate the bleeding post-operatively. Well, Sean would be a fairly easy patient for going tourniquetless, especially if you were just starting out. But he is also ideal in that he wants to get back sooner to activity. A nerve injury or untoward event would be more devastating to him because he's younger and has longer life to live and is also still working and traveling. So it has the benefits of really getting him back sooner with less pain and less risk. I think that going without a tourniquet in terms of patient experience, they have less pain, so we use less opiates post-operatively. They're discharged earlier. They have less bleeding. They have, I think, earlier return to function and regain motion quicker. I go without a tourniquet 100% of the time. I don't think there's any indication to use one.